Hello to this part of the online course on public health ethics. In this part we're going to talk about the ethical principles and theories and the core public health values. Hopefully by the end of this part of the course you'll be able to differentiate between the main ethical theories, identify key ethical principles and values relevant to public health practice and research, present a moral argument on an ethical issue related to public health based on the ethical theories and values that we're going to introduce. How do we as humans tell right from wrong? Basically, there are many approaches to tell right from wrong. In this part of the course, we're going to focus on two main approaches, the philosophical approach and the religious approach. And we will give a couple of examples in the next part. So, how do we usually approach an ethical issue? We need a set of ethical standards. Why? So that when we judge an issue or an act as right or wrong, we need to refer to some sort of reference, moral reference or moral or ethical standard on which we're going to tell whether this action is ethical or not. Then we need to have proper case analysis. After that, we need to decide on how we are going to apply the decision that we came up with, or the modality of the decision making. Then even after the decision is taken, or at least a choice is favored, let me say it this way, then we need to follow up on this decision to know or to assess the impact of our decision. Ethical guidance in public health ethics. In ethics in general, in bioethics in general, we have three main categories of moral reference. There are some philosophical schools. We're going to be introduced to them in a very brief way. The main schools that you may encounter in reviewing the literature and your readings, they're the ontology, they're the utilitarianism, there's the rights-based, there's the virtue ethics, casuistry, social contract, and principalism. Don't worry about the big names. We're going to go through them one by one and to put them as simple as possible. Indeed, there are other kind of references. Philosophies are more or less product of human intellects, but there are religious references. For instance, there is the Islamic ethics and jurisprudence, and we're going to talk about it in a brief way as well. There are Christian ethics, Jewish ethics, in addition to other philosophies which are considered by their followers as religions, like Buddhism and Confucianism. However, in public health, we have a set of principles which I've gathered from the literature on what kind of principle that ought to guide the public health practice. There are many. We're going to again go through them fairly fast as well. There's the principles of utility, efficiency, liberty, transparency, participation, review and revisability, effectiveness, fairness, reciprocity, and solidarity. This is just a kind of mapping, and then we're going through the details. The first school is known as the deontology. Deontology basically it's called the duty-based ethical school. So it is duty-based. That's to say, people should act so as they fulfill their duties towards others. The acts should always follow a set of maxims. For example, if we agree that among ourselves that it is the moral thing, the ethical thing is not to lie, then all of us should agree that we should not lie. No one should have any exceptions from this maxim or this rule. However, it's less concerned with the consequences. For example, if we're talking about the duty not to lie, so basically no one should lie whatever the consequences of not lying could be. Let's put it in an example from the public health. There's the duty of care for Ebola patients, for H1N1 patients, or whatever kind of patient, although this carries the consequence of risk to the healthcare provider. The rights-based ethics involves a larger number of principles and is addressed more toward the actions of institutions and government. For example, there is the Universal Declaration on Bioethics and Human Rights, which is developed by the UNESCO in 2005. An example from public health, in Article 13, It says that solidarity among human beings and international cooperation towards the end are to be encouraged. For example, governments are more or less obliged, if you like, to share the viruses that they've extracted. Like the consequentialism or the utilitarianism, it's mainly about the consequences of an act. So the right action is what produces the greatest sum of pleasure in the relevant population. There are many schools, many definitions, but as I said, I'm trying to put it as simple as possible. The consequences matter, yes they do. For example, we restrict them. There are some restrictive measurements on the movement during pandemics, so that more people are being protected, although it's on the account of the individual liberties and individual freedoms. There are issues related to mandatory vaccination, so that to build the herd immunity of the community. The contractualism or the social contract theory, it's more or less, to put it like briefly, it's kind of like agreement among ourselves, in the individuals in the community, so that they accept enforced social arrangements among themselves. In the political theory, to explain this, it claims that the legitimate authority of government must derive from the consent of the governed people. So, which is basically more or less, we're talking about the democracy. And this is kind of a challenge again to many countries in our region, and to what extent this kind of ethical theory can come into place. For example, and according to this kind of contract between the governments and those who are being governed, i.e. the people or the community, to differentiate or to strike a balance between the forcible acts, voluntary compliance with the public health authorities. Principalism is fairly well known and frequently cited in the literature, in most of the teaching of ethics as well. There are many examples of principalism, which is basically putting the ethical theory into a set of principles. For example, the Hippocrates Oath, that first do no harm, this is a principle. Then the Belmont Report in 1978, and afterwards they talk about 3 principles. And then more recently, Beauchamp and Chadres came with the 4 principles, which are going to be discussed. Next slide. So, the 4 principles model, as we've just said, it's developed by Beauchamp and Chadres. They focus on 4 main principles. First is the principle of autonomy, which is basically about giving the people the freedom of choice in relation to any decision related to their health or their bodies, as long as they are capable of making such decision. The second principle is beneficence. It is a duty to do good for others. Non-maleficence, it is the duty to not to harm others. And the fourth is justice, and it has different meanings, but usually they refer to the distributive justice.